and we look forward to presenting tonight. So we do want to say this is the Department of Integrative Medicine. This is part of our family education series, and this is Chiropractic for Moms. Before we get started, we do want to just say we have a little disclaimer here. Before you participate in the latter part of this portion, the latter portion of this lecture, we will be doing some exercises. So we do encourage that you have permission to do exercises from your healthcare provider. And if you are participating and feel any level of uncomfortable or experiencing any pain, we will advise you to please stop immediately and consult your provider. We would encourage you right now to have comfortable clothing on, a pillow, a blanket, an exercise mat, and a comfortable chair so you can fully participate with us in the latter portion of the program. So with that, I'm going to just continue. So thank you so much. My name is Dr. Lori Nuzzi. Thank you, Parminder, for the excellent introduction. I am certified in pre- and postnatal care, certified in pediatric care, certified in sports chiropractic medicine. I am a chiropractor for 32 years in this area, for 27 years owned and operated Nuzzi Chiropractic Family and Sports Center, where I had an opportunity of combining holistic medicine, including chiropractic, acupuncture, massage, and integrative nutrition. So this is an area that I'm very passionate about, holistic care and working with individuals pre- and postnatal care. So I'm going to also introduce Dr. Christina Markar, my co-presenter tonight, and give her an opportunity to tell you a little bit about herself.
Good evening, everyone. My name is Dr. Christina Markar Kowam. I am a chiropractor for over a decade. Dr. Nuzzi and I both went to the same chiropractic school, New York Chiropractic College, recently known as Northeast College of Health Sciences. I've had certification in functional movement therapy, SFMA. I am certified in Cox flexion distraction, and I spinalize in posture as well as helping moms pre and postnatal prepare their bodies, prepare their pelvis for having a baby. So we're really excited to bring this to you guys and can't wait to go into it. I'll give it off to Dr. Nuzzi here.
Thank you so much. So as we said, we are the Center of Integrative Medicine at Valley Medical Group. Our 3 service lines are chiropractic care, acupuncture, and in the latter part of 2025, we will be bringing on therapeutic massage. Our approach is a holistic approach to pain management, health, and healing. We are combining modern medicine with the ancient healing techniques in state-of-the-art facilities to optimize your well-being. You may be wondering, what is the holistic factors? And this is part of what separates us here at Valley Medical Group Integrative Medicine, is our holistic approach to your health and healing. We recognize an individual as more than just a part. We recognize that there are parts of our body. There's a spiritual body, an emotional body, a chemical body, a physical body, but that makes up one person, one you. So when we are doing a health assessment and making decisions with you regarding your health, we want to discuss with you different aspects of your health, whether that's the state of your emotional well-being, your general fitness levels, the dietary concerns, your level of hydration, exercise habits, quality of your sleep, work-life stress balance, the social supports you have, the relationships, community involvement, spiritual beliefs, and a sense of your purpose. So we recognize that there is a holistic approach to health and healing, that many people will come in with one singular complaint, maybe that's back pain, but back pain often goes far beyond that one complaint, and making good decisions for you and really creating a path forward requires us to have a deeper understanding of you, who you are, what your life is about, and the goals you have for your health. This brings us to what is chiropractic. As we're here tonight learning about chiropractic and chiropractic for moms, we'll start with the basics. Well, what is chiropractic? Chiropractic care focuses on the diagnosis and the treatment of musculoskeletal disorders, particularly those affecting the spine. Chiropractors often use hands-on techniques, but they're not isolated to hands-on techniques. There are other techniques that utilize instrumentation. Those techniques are designed to relieve pain, to increase mobility, to increase posture awareness, and essentially promote an overall better health. Our goal is to restore mechanical function, increase mobility, reduce pain, particularly related to the spine, but other joints as well. We emphasize the body's ability to heal itself with natural treatments. The principles of chiropractic. First principle we adhere to is that the body has the ability to heal itself. We are not there to heal your body. We are there to help facilitate a healing process and to create a healing environment. We also believe that the spine plays the primary role in one's musculoskeletal health and as it relates to their neuromusculoskeletal health. Misalignments of the spine can often affect your health and interfere with your nervous system. We recognize this when we're in pain, but sometimes that does not, pain is not the only indication that the spine has misalignments or is in some state of dysfunction. The holistic approach is that chiropractors, again, we take the whole body into consideration, your whole life, and we are really trying to find the root cause rather than just gearing our treatment plans in a symptomatic way. We recognize a non-invasive treatment. We are non-drug. We are not surgical. We recognize, again, the body's natural ability to heal itself if fostering that environment. We are a drug-free treatment for pain relief and healing. Chiropractic, is it safe for maternity? Well, for the moms that are on this webinar with us, chiropractic is safe for maternity in most cases. So chiropractic care is a generally safe treatment option for our maternity patients. However, we do need to make sure our programs are tailored specifically to your needs. And we want to make sure both baby and mom are safe by using specific techniques that are designed for our maternity patients. For example, there's a technique that's often referred to, it's the Webster technique. This is a well-known chiropractic approach to improving pelvic alignment and fetal positioning, often used for breech turning, especially in the later stages of the pregnancy. But chiropractors, we are careful to select our patients and the treatment options available to our maternity patients so we can keep mom and baby safe. There are specific techniques that we will use during our maternity patients. So these techniques are spinal and pelvic manipulations. They are often done by hand to adjust and correct the misalignments of the pelvis to improve function. There are other techniques, soft tissue techniques. These are mobilizations or massage techniques that gently apply pressure in different areas to stretch the soft tissue or to manipulate the soft tissue in specific ways to relieve discomfort and create best pelvic health. What to expect when you come into the office. What you can expect is a very comprehensive consultation. We will take an extensive medical history. We will understand your current health concerns. We will review your lifestyle. We'll then proceed with a physical exam. The examination is a postural evaluation, ranges of motion, orthopedic tests, neurological tests, and palpation in order to determine what is the specific issues you may be dealing with and the best way forward. We'll discuss a treatment plan. Those treatment plans are very specific and tailored to you. They may be set in stages based upon where you are in your pregnancy. So we may have an individual who starts in her third trimester, and we'll have a plan that's essentially getting her to her delivery, and we'll reevaluate that plan after the delivery so we can create a postpartum plan that really encourages the best healing and restoration of pelvic function. Sometimes on your first visit, for some individuals, you may even receive your first chiropractic adjustment. Typically, these are gentle and they are specific for our pregnancy maternity patients. But before we go any further, it's really important, especially for our maternity patients, that we understand what is pelvic health. Sometimes we hear these terms, we may hear the term pelvic floor, but we might not understand what that means and the real importance of the pelvic balance, the pelvic health during in all 3 stages of the pregnancy and postpartum. The pelvis, so I'm going to go through a little anatomy, give us a little sense of why this is important. The pelvis is designed with 3 bones for, if we consider the coccyx, the sacrum, the triangular base, bone at the base of the spine, the 2 larger hip bones, those are called your ilium, and the little tailbone, that's called your coccyx. There are 3 joints of the pelvis, essentially, 2 sacroiliac joints, and the pubic symphysis in the front. But the pelvic health also requires stability between the pelvis and the spine. The joints between the pelvis and the spine are called the lumbosacral joints. That is where the base of the spine is meeting the pelvis. And then the pelvis also requires stability and movement from the hips. The femur as it articulates into the hip socket or the acetabulum. We want stability and movement in all 3 of these joints. We also want stability within the lumbar spine and mobility and stability within the hips in order to have a more easier delivery at the end. In the beginning of the pregnancy, in the first 12 to 14 weeks, we're going to have a surge of hormones. That hormone is called relaxin. That hormone is very specific for the pregnancy and is released by the attachment of the placenta to allow for the relaxation of ligaments. We specifically want the relaxation of the round ligaments, which are the ligaments that secure the pelvis, hence they are called round ligaments, and keep the pelvic base tight when we are not pregnant, but they will expand and loosen as we mature in our pregnancy and going into our delivery. In our pre-pregnancy pelvis, we want a circular space during our pre-pregnancy, our non-pregnancy pelvis, but at the end, especially for our delivery, we want this pelvis to change shape in order to accommodate the descending baby's head and the descending baby's shoulders, so we can have an easier delivery. If we did not have this adaptation of the pelvis and the thinning of the soft tissue, it would make our deliveries extremely difficult, if impossible. So you can understand just by this overview that the pelvis is extremely important. We need the pelvis to go through stages of changes, and those changes will begin from the beginning, and they will continue all the way to delivery. Many times we will have some level of discomfort or dis-ease if the pelvis is not expanding symmetrically, if the pelvis is not widening appropriately or thinning and stretching those soft tissues to allow for the expansion of the uterus, the proper positioning of the baby. We can experience lower back pain, buttock pain, leg pain, sciatica pain, hip discomfort, pelvic instability, round ligament discomfort, poor posture, and breathing mechanics are altered. For some individuals, this can happen in the early stages of a pregnancy, within the first trimester, but we would say the majority of individuals that seek our care, they're coming to us anywhere between the 15th and the 25th week, where the body is starting to really make significant changes and or having difficulty making those significant changes. That brings us to Dr. Marker's portion of the presentation. We are going to talk to you about how to maintain, how to strengthen, and give you some exercise opportunities. So if you would like to, you can get into your comfortable position. We will be bringing you onto the floor shortly. So if you need a moment to grab a towel or an exercise mat, now is a good time.
Thank you so much, Dr. Nazi. Yes, I will speak slowly on this slide to give moms, dads, parents, caretakers a moment to get themselves ready. In the meantime, we're going to discuss how to maintain, correct? So the important thing is not only getting treatment, but getting the right treatment. And what does that mean for you as mom? What week gestation you're in, what presentation baby's in, what symptoms you're having, all of those really kind of cater to what the right treatment is for you. We're also going to be talking about the importance of strengthening the muscles in your pelvic floor. Um, we mostly don't even think about it, but even when we go through our menses, our uterus itself is a muscle. And it's just one that we really don't stretch and we don't know how to, right? Because it's kind of internal. But we want to work on the pelvic floor and really kind of help to not only strengthen and stretch everything to the right length, but to really prepare you for how much change is going on as you are growing one or multiple humans and while you prepare to deliver and post delivery. Um, working with a chiropractor to do that is really important, not just with the muscles, but also with the pelvic joints. People tend to forget about the sacroiliac joints, the pubic symphysis, like Doc had mentioned, the sacrococcygeal, and the lumbosacral joints. All of those are extremely important and allowing and facilitating for the pelvis to open up and allow baby to come through properly. We don't want pelvic unleveling. Like I always tell my patients, the last thing we want is to build a house on uneven foundation. And when our pelvis is tilted, we have some rotation, we have anterior tilt, or our hips are uneven or rotated in any way, it's going to be difficult to now grow a baby on top of that, have your center of gravity change, and have all of that impacted. And we also want to talk about maintaining healthy habits. So here we are. Um, you know, Healthy weight gain during pregnancy, avoiding constipation. That's a big one that parents, moms have. And of course, as well as, incontinence. And then practicing good posture, because with good posture allows for better, not just spinal, but pelvic. All right, Doc. Okay, let's get to work. We're going to start and end with a diaphragmatic breath. It's super important, not just for us to calm ourselves, but it's also important for us to actually use the diaphragm, which is getting kind of compressed up into the lungs. And the diaphragm is what separates our heart and lungs from the rest of our organs in our stomach, in our core. So it's a muscle that's completely round and goes around the lungs like this. So we want to make sure we're really using that to get the full expansion of our lungs and to help with moving all of our organs so they get time to breathe too. Okay, so I ask that you would comfortably sit or lie with one hand on your chest and one hand on belly. And we're going to ask that you inhale slowly through the nose, feeling your belly rise like you're smelling roses. And exhale gently from your mouth, letting your belly fall. This is foundational for pelvic floor awareness and calming the nervous system. Sometimes I know, at least for myself, when I was pregnant, I would get anxious with certain things, anxious with the unknown, or just getting through daily things, having trouble. When we take this deep breath, we're connecting not only with our breath, but we're also connecting with baby, and we are also activating our vagus nerve, and that will help us to calm our body because baby feels what we feel. They laugh when we laugh, they get upset when we cry. So when we calm ourselves, we're not only working on our pelvic health, but we're creating a better environment for both us and baby. Next, we are going to work on a supine pelvic tilt. Supine meaning on your back, face up. And then pelvic tilt, we talked about what the pelvis is. And this right here, if you look in the top photo, when we usually lay down on the floor, we usually have a little divot, an area where we can put our hand between our low back and the floor. And while that's not usually a problem, you might feel increased pain in that area with pregnancy because baby's growing in our belly and pulling us forward, changing our center of gravity. So, what we want to do is we want to lay on our back, bend our knees so our feet are flat on the floor, and we want to think of our pelvis like a bowl of water. We want to try to rock it back like this. And when you do so, you'll physically feel your spine start to touch the floor. And how you know you've done it properly is when you come to put your hand in between your back and the floor, you can't get it in there the way you could before. It should be not easy to do. So you want to do that. Lie on your back, knees bent, feet flat. You can have your knees bent hip width apart or a little wider, whatever's more comfortable for you. And you're going to gently tilt that pelvis to flatten the low back. And you're going to hold for 3 to 5 seconds. So let's first take a nice deep breath in and out. And as we breathe out, start to tilt that pelvis back. You should feel a little bit of a relief in your low back, but it is kind of a mini workout into that hip and pelvis area. Good. And let's do that one. Okay. We're going to do it one more time. Take a nice deep breath in, all the way out. And as we breathe out, let's tilt that pelvis back. Give some love to that low back. It's doing so much work. Your body is really, truly amazing, moms. And release. Very good. Okay, we're going to move on to the blooming flower visualization. So this right here builds breath-body connection and helps support pushing technique. So I have gone and met with all the different departments that Valley offers, which are fabulous for expecting parents and new parents. And this is even a technique that we learned from them. So it is a visualization of a flower starting as a little bud and slowly opening up. So we're going to ask that you either sit or lie comfortably. I'll give you a second to do that. Okay. I'm going to ask that you close your eyes. And on each inhale, you're going to imagine a flower gently opening. And on the exhale, the flower softens but stays open. What this is going to do is help to prepare the pelvis, prepare the body for going and thinning out and opening up for pushing and delivery. This is a very important technique. So just make sure you keep this one in your back pocket. Okay, Doc, you can go on to the next one. This is a great one. Windshield wipers. This one's going to help with the pelvic mobility and that SI joint comfort. So remember how we talked about, so your sacrum is kind of shaped like this. The top, the base is of the upside down triangle. It's flat like this and wide, and then it narrows down like this to where it attaches to the coccyx. And right here is your ilium, right? So that's our hands on our hip. Those are the bones that we feel when we put our hands on our hips. So sacroiliac joint that goes like this. With each step, these work inversely with each other. Remember, there's one on each side. So they're going to go like this with each step we take. And when we sit, you might feel it a little uncomfortable on one side versus the other. The windshield wipers is going to help with that. So what I'm going to ask you to do is lie on one side with your knees bent, similar to that first picture on the left. I'll give you a moment to get into that position. You know you got a growing belly, so it takes a moment. Okay. And from here, we're going to gently rotate our knees towards the floor and slowly back. When you're taking it down to the floor, breathe out. On the way up, take a nice deep breath in through the nose. Go down the other way and back up. Beautiful. This is going to, again, help with pelvic mobility and SI joint comfort. Here's a favorite of mine, happy baby. We all want happy babies and happy moms. So in order for us to get here, I'm going to ask that if you are able to lie on your back, you can do so. Again, taking out that curve in your low back. And you're going to bend your knees towards your armpits, towards the axillas. And then you're going to take your hands and go ahead and grab from the outside and either hold on to your feet or your ankles, whatever feels more comfortable for you. And then when you're there and you're in a comfortable position, you've kind of settled into it with your pelvis so it's not affecting the belly. You're going to gently rock from side to side. And this is going to feel like a nice little gentle massage on the muscles in your low back and in the hips. And only do this if it's comfortable. Always to comfort, not through comfort. With everything that we do today and anything you do at home, I'm sure your doctors will let you know the same thing. To comfort, not through it. Okay. This right here is meant to help stretch all the muscles, give your back a little bit of a break, and really allow you to just breathe. It takes pressure off baby too. Next, we have cat cows. So cat cows are kind of funny. They're exactly the type of animal you see, like you would imagine in the picture, right? They're great for not only your spine, but for your breathing, the connection between body and breath. And it's going to really, really help moms in their third trimester. This is an opportunity to really kind of take it and open everything up like this, and then go back into the cow position, which is going to vertebrae by vertebrae, hopefully give you guys some space. So we're going to ask that you would slowly get on your hands and knees, okay, onto something comfortable on the floor. Hopefully you have a mat, and you're going to be having your ankles, your wrists, under your shoulders, and your knees under your hips. They're going to be at 90-degree angles. And when you inhale, you're going to drop the belly like the cow and bring your head all the way up. And when you exhale, you're going to round out your spine, just like how you see those pictures of like a crazy cat. And then you're going to slowly keep doing that with your breath. Inhale through the nose always. Exhale and round out that spine. Try not to deviate shoulder from wrist or hip from knees. Okay. Here we have the supported child's pose. This is a nice, comfortable pose just to kind of give you a little bit of love, okay? It's going to calm you, open the pelvis, the hips, and we ask that you use some props for some support, especially, if you're further along and you've kind of got a little belly going. So you kneel and bring your big toes together, pointing your feet kind of in this position, and keep your knees nice and wide. And as you fold forward, take a deep breath in, all the way out, and gently fold, relaxing either over a bolster or a pillow with a blanket on it, just to give yourself a little gentle comfort, much like you see here in the picture. Let your forehead rest and breathe into your back. When you're pregnant, you know what that means. Definitely feel that. Allow yourself just a few seconds here. Give your body permission to breathe and feel comfortable. Wonderful. Lastly, I'm going to end the active portion with another breath. I think it's important. Not only is it important for us to calm ourselves and calm our body and connect it, but it's also extremely important for us to do before we do anything that would be remotely strenuous on us or baby. Things that we didn't think of, like if we need to try to open a door that's like a little wedged or something, lifting anything. These are really important breaths for us. So make sure that you use them as often as possible. So again, one hand on your chest, one hand on baby. Take a nice deep breath in through your nose. And all the way out. Notice this connection and see if you feel any tension anywhere. Is it in your low back or your hips? Anything in your neck or shoulders? I'm sure those get tired too. Let's take 2 more of those, shall we? And out. Last one. And out. Great job. And now we'd like to talk about the VMG difference, Valley Medical Group. While you can see any chiropractor We do love the approach that we offer here at Valley Medical Group because we have such a wonderful team of experienced professionals that are definitely committed to your well being. We work to empower and achieve not only your health and wellness on our end, but what are your health and wellness goals for yourself? And we work in a very supportive environment. We have so much fun and really enjoy our time, not just with each other, but especially with our patients, having them tell us that they're able to do things that they haven't been able to do, feel better than they felt in years, and getting active listening providers who really want the best for you, whether that be, while you're, pregnant or postpartum, how to help yourself improve from there on in. And we want to make sure that we create a customized care plan that's specifically for you. Again, where you are in life, what your goals are. We consider ourselves not only doctors, but patient advocates. So where you want to go, we want to meet you. And that's our goal, is to help you get there. Doc, I'm going to pass it off to you.
Great. Thank you so much. Oh, Dr. Marker, that was fabulous. The breathing is just so refreshing and grounding. Good for everybody. I hope you all enjoyed that. Thank you so much for spending time with us tonight and allowing us the opportunity to introduce ourselves and walk you through this little journey. Again, thank you for your time, Parminder. We appreciate the opportunity to come and speak to the community. George from the library, we are very grateful for your invitation. And again, thank you so much. If there are any questions, we would be able to take them now.
Thank you, Dr. Nazine, Dr. Marker. I do have just a couple questions that came in.
Sure.
So let's start with how soon after delivery can I resume chiropractic care?
Oh, that is a great question. That is in general, and we've had many individuals who are literally coming from the hospital to get their pelvic examined. So there really is no specific time frame that we say it is safe from the time you are delivering. You can be evaluated and certain techniques can be started with you to gently try to encourage the pelvis to continue its journey. The pelvis in your body is not done. There's healing that's still left. But we would also encourage, if you haven't seen us within the first 2 weeks, really try to get to us by that second week. Your pelvis is starting to make some of the retraction, is starting to come back and trying to go back into its pregnancy state. And we want to just make sure you are on the right track. So the sooner we evaluate you, the better. But we would absolutely say 2 weeks is a safe marker for those who are either vaginally delivering or through cesarean. It's a great question. Thank you.
Great, thank you so much. Another question. What signs might indicate that I should not continue chiropractic care during pregnancy?
Well, certainly if you are experiencing signs that you should not continue, I would say if you are not accomplishing your health goal, there isn't an endless amount of opportunity. We want to take an opportunity to try to establish the pelvic movement. We want to encourage the stretching of the round ligaments. We want to stabilize the sacroiliac joints and the hips and the lumbar spine. But there are many techniques and there are different practitioners. So we cannot be too bold to say that we're the only techniques or the individuals that can help maternity patients. If we are not feeling we're accomplishing something within a reasonable amount of time, a handful of visits, we would often make the recommendation that an individual seek another provider. And sometimes that's whether that's me telling an individual, I think you'd work better with Dr. Markar because she may have techniques that I may not be familiar with, or she may have just a different approach to it. Or we're sending you over to the Valley Medical Group's pelvic floor therapists. We also have different massage therapists that we work with. So we have a plethora of health professionals. it's not a one size fits all. So if we are not accomplishing your goals, we will most likely be making the recommendation that we seek another professional.
Great, thank you.
Welcome.
Another question. What techniques do you use to support abdominal and pelvic recovery after a C-section?
Okay, so I can take that for you. So after C-section, we want to make sure that first and foremost, the patient's doctor has signed off on her ability to return, just concerning if there were any complications. We need to know that from the get-go. Things that we can do to help. I am certified in levels 1 and 2 in taping. So let's say mom's having really a hard time with her pelvis. She can't really lay down because she's had the surgery. So we can do treatment seated, Dr. Nazi and myself. We can also apply a heating pad, do some soft tissue work, some gentle work, or we even have something called an activator. So for people that cannot be rotated, or mom who's just had that, she's undergone a cesarean section, which is such a heavy procedure, we can use an activator. It kind of performs an adjustment without the actual hands-on manipulation. So we can offer that. Of course, we have heat and muscle stimulation as long as mom's cleared to get that, which I think most everyone is. And yeah, we have so many different techniques, hands-on, instrument-assisted soft tissue techniques. We can always refer for, patient wants to get some sort of seated treatment too. This is not a problem. We're happy to cater to mom and her time of need.
Great, thank you. I have one more question here. Do you treat issues related to breastfeeding posture, like the upper back or neck pain from nursing?
Yes, often. I would say the majority of women, as they transition from their pre and post natal bodies and activities, oftentimes the complaint will shift. So during the pregnancy, we will be addressing lower back issues, hip issues, pelvic issues. That's the predominant complaint. However, almost immediately, those complaints shift. And we then start to address the upper back issues, the postural issues, the feeding issues. We definitely love that portion of the care. That's a great time to be working with mom and baby. It's just a wonderful, magical time when you are breastfeeding and you're having that opportunity to bond with your baby. And we do not want you in pain and suffering through that, or just diminishing the real special nature of that time, or the ability to bond because you are in pain. So we have addressed that. There are many techniques to address that, and other additional passive modalities that can be used in the postpartum phase that can't be used during the pregnancy. So we have more options available to us at that point in terms of treatment and therapies that we could be using to help